The stress of having IBS, that's what's causing the stress and the anxiety, is that you got IBS, that you got a digestive problem, not the other way around. It's not the anxiety and the stress that's causing the IBS. And so we find that usually it's the reverse of what people think. The problem is there are hundreds and hundreds of different things that contribute or can cause IBS. And your symptoms don't really point you in any one direction. You might think they would. You think because you go to doctors and they're curious about your symptoms, and we need to know about your symptoms too, but they actually don't shed any light on the underlying cause. We are thinking about bacterial overgrowth, and we're thinking about candida, and we're thinking about parasites, and we're thinking about food reactions and intolerances and allergies and sensitivities and lots and lots of different things, but we've got to narrow them down for each patient to figure out what's really the problem. Otherwise, you just get the one size fits all. Hey, everybody just go do this plan I created and maybe you'll get better. And if you don't, well, it's not my fault, kind of thing.
Hey there, it's Mike Mutzel with HighIntensityHealth.com. Thank you so much for tuning in. Today we're live with IBS expert Dr. Stephen Wangen, and we're going to talk about his advanced therapies and his IBS treatment center here in the Seattle area. And I believe they have 3 different locations he'll dive into, but he's overcome and helped improve his own gastrointestinal function and helped thousands of patients. He's an expert when it comes to this area. So we're going to pick his brain and get down and dirty into the gut and give you practical tips to help you improve your gut health. So Dr. Stephen, thanks for being here.
Hey, Michael, my pleasure. Thank you for inviting me to be on your podcast.
Absolutely. So I saw on your blog, you're a mountain biker, you like your outdoors and stuff like that. We have a lot of athletes that listen on the show here. So maybe let's talk about your journey into IBS and how did you get so interested in, treating that clinically, and what have you learned through that experience?
Yeah, a lot of good questions in there. It's a big story. I had IBS and I went to doctors and they said the same kind of things that people are used to hearing. They said, well, everything checks out. You seem to be fine. You don't have any problems. And I thought, well, that's crazy. I know I've got a problem. I can feel it. I can tell. I try to go for runs or bike rides or something. And then the unpredictable happens and I'm like running for the trees. And that's not a good thing. And unfortunately, lots and lots of people share in this problem. And so what happened was I was studying medicine and going through med school and figuring out how to solve my problem, which I wasn't learning actually from the doctors there or from my training, really. I was having to figure it out on my own. And then as I started practicing medicine and working with patients, I found that I really had to start from scratch and deal with each patient individually and figure out, wow, what do we need to do to solve this problem? And as I worked with more and more digestive patients and saw more and more people get better, I realized it was a very complex area with lots and lots of different issues that were underlying it, and that it was being completely missed by the medical system. And essentially what we needed was a new specialty in IBS. And that's how I ended up creating the IBS Treatment Center, was really just out of my own experiences and sheer demand because there was so little that was being offered in this field.
Mm-hmm. Yeah, that's a great point. I've heard my mentor tell me that IBS is kind of a wastebasket disorder or kind of classification, when you don't really know what the cause or the reason why someone has GI issues, you just label it IBS and then people are on their way. You have the ICD-9 code and people can rock and roll. But maybe let's kind of talk about what is IBS? And so for people that maybe have periodic bouts of constipation and diarrhea, and they just think that may be normal or it's something that they ate and they don't really, attribute that to IBS. I mean, I think there's a lot more people maybe running around with IBS and may not really know it. So maybe let's kind of define IBS. What is it?
Yeah, that's a good point. And I think you're right. There are lots of people with it who don't realize even that they have it. But what it is, so what IBS stands for is Irritable Bowel Syndrome. And Irritable Bowel Syndrome is a great big giant label. It covers the whole ground. So people might assume that, for example, they might think, well, it's always diarrhea. Well, in fact, it's not always diarrhea. And a lot of people with IBS have constipation and don't have any loose stools at all. It doesn't have to be either, though. You don't have to have diarrhea or constipation. You could just have gas, or you could just have bloating. You could just have abdominal pain and not have any of those other things and wonder, well, why does my tummy ache? Why do I hurt? All those things are covered in IBS. And IBS patients will either have one of those symptoms or might have all 5 of those symptoms. So they could range, they could switch, they could sometimes be constipated, sometimes have loose stools, sometimes be gassy, sometimes have abdominal pain. So it's really, you could have any one of those things or any combination of those issues. And even those issues aren't always clear cut because, for example, a lot of patients don't identify, for example, with constipation because they think, well, constipation's when I just never go, or when I do go, it's really hard. I have to strain a lot. I got little rabbit pellets. I don't really know, those are what people think of with constipation. And yet a lot of patients will have bowel movements daily, maybe even multiple bowel movements, but they just never feel relieved. They just feel like, well, I go to the bathroom, but it never is finished. I keep going and I keep going and I keep feeling like my business isn't done. And that's another type of constipation. Other patients have loose stools, but not really what they think of as all full-blown diarrhea when maybe you've got this terrible stomach flu or you've got this huge foodborne illness, and you've got food poisoning and wow, that's diarrhea. Everything just blows out and then you feel okay after a while. But they have maybe something in between where they're like, well, yeah, my stools aren't real well formed. They tend to be loose, but they're not really thinking of it in terms of diarrhea. So there are all these variations that fall under this big umbrella of IBS. And like you said, it's a label. It doesn't really tell you anything other than, wow, you've got a digestive problem, but you still don't know why you have a digestive problem. You still don't really know anything about it other than you've probably had a lot of other things ruled out by doctors. And so you end up with this label. And that's really what IBS amounts to.
Let's kind of talk about maybe next steps then. I think, a lot of people identify with a lot of those symptoms that you mentioned, like a little bit of, like I've heard people say, I feel like I have a brick in my stomach and just like food just kind of sits there. And like you said, they go to the bathroom, number 2, but it's still, that bloating doesn't go away, or they have bad breath, or, foul smelling stools or gas and stuff. Like, as a clinician, what's your next step to kind of see what is the cause, and then maybe how do we, reverse, kind of the abnormalities that are going on? How do you diagnose the gut?
Well, so there's the diagnosing of IBS is a big issue, big question. And so what usually happens is people go to their doctor, their regular primary care doctor or GP, and their doctor does a physical exam on them, runs some blood tests, and is essentially ruling out some other things, ruling out things like, do you have an ulcer? Do you have gallstones? Do you have appendicitis? Do you have a tumor, you probably don't, but do you have one of these things? And all these tests come back fine, right? They're going to be fine. You're going to say that. And so their impression of you is that you're fine. So they come back and they say, well, everything checks out. You're okay. And you say, well, wait a minute, but I got these symptoms. I've got this problem that's really bothering me and then we should talk about that, how much it impacts people's lives. And what happens is they know they're not fine, but they start to get this impression that it must be in their head. It must be all in my head, because pretty much the recommendation is, well, maybe you should take some fiber, or maybe you should just try to relax, because maybe you're just a little too stressed. And it's too easy in medicine to push things off as stress, because that's kind of convenient and everybody's got some form of stress. I mean, there's nobody who's really just lounging around saying, well, I don't have any stress at all. Maybe there's some people out there like that. I'd like to meet those people.
They live in Colorado, probably.
Yeah, exactly. Yeah, Colorado. I grew up in Colorado.
Right.
But so they don't. They feel like, but I go on vacation and I'm, and I still have issues then, or they can't go on vacation because they have too many issues and they can't travel and leave the house and do all these things they want to do, and so they're feeling really stuck, like they're the only person out there that must have this problem, because gosh, the doctors are really bright. I'm going to see these really smart people. They're well respected. They're well known in their field for what they do, and they can't help me. So something must be wrong with me, because gosh, I'm seeing really bright people and they can't help me. So it must all be in my head. And ironically, what's happening is those doctors, although they are really bright, they're bright in a different area. They're not IBS specialists. They're specialists in other things, or they're generalists, but they're ruling out other things. So even if you go to the gastroenterologist, which a lot of people do, which is usually the next step, And what a gastroenterologist is a specialist in really in scoping your intestinal tract. So they generally do a colonoscopy or an upper endoscopy where they're scoping you down through your throat and looking at your stomach and your upper small intestine, depending on your symptoms and your issues. And they're scoping and they're looking around, and generally they're also saying, wow, everything looks fine. Or, oh, maybe there's a little bit of irritation, but there's no big issue. Or, oh, we found a polyp and we removed it, but that has nothing to do with your symptoms. That's not causing you to be constipated or to have diarrhea. It's just that removing a polyp is a smart thing because that can prevent colon cancer down the road. But that's what your gastroenterologist is doing, is looking at those kind of issues. So then they are done with their procedures and they say, well, you're fine. And you say, but wait a minute, I'm still not fine. Still nothing's changed. I haven't gotten any better. I haven't gotten an answer to my problem. And so unfortunately, at that point, you're still in the same place you started. You've got this label now, but nothing's changed. You've got this label of, yeah, I have an irritated bowel, but I already knew I had an irritated bowel. You've now just given me the irritable bowel syndrome label, but otherwise you feel the same. And ironically, there are tons and tons, millions of people who have exactly that problem. And that's really been something that's really sad to me, that those people have all been stuck without an answer up to now.
Right. And to add insult to injury, maybe I have a friend like this who he has IBS, classic. I don't know if it's Crohn's or colitis or, what part of the intestinal alimentary canal is affected, but his recommendation from his gastroenterologist, which he doesn't really believe in natural medicine for some reason. I don't try and press, friends too much, just kind of give them little hints, because you don't want to like cross boundaries and so forth. But he's on the anti-TNF alpha antibody inhibitor, right? So just an anti-inflammatory, no dietary recommendations, no avoiding gluten, no avoiding wheat, corn, soy, no stress management, just that drug. But he still has, all these bouts of constipation, diarrhea. He can barely, step away from a place that he would talk about, quality of life. I mean, can barely work because he doesn't know when the next time he's going to go to the bathroom is. That's how bad the diarrhea is. So, let's kind of maybe you wanted to expand on that, maybe the psychological effects. So someone comes in, they get diagnosed with IBS, they have no real strong, root cause recommendations to get the root cause of this. And then how is their quality of life and psychology affected? I mean, it must be very terrifying going out in public, not knowing, if there's going to be a bathroom nearby or if there's going to be a wait, or maybe share with us some stories or feedback that you have on that.
Well, absolutely. Yeah, it's huge. And I get to hear the most incredible things to me. To me, they seem really profound because people's lives are being impacted so much. So, for example, I'll have patients, I've had a couple of patients recently who've come in and said, I can't take my dog for a walk because they just can't be out in an unpredictable environment where's the nearest bathroom? I mean, are they going to go knock on somebody's door? What are they going to do? They just don't even feel like they can do that. I had a patient not so long ago who said, I can't take my daughter to the bus stop. And, so they're literally you can picture this person in the house, standing at the window, waving because they don't feel comfortable enough to be able to leave the house in the morning because their bathroom business isn't done, or they don't know when it's going to be done. It's really sad, these things that people are experiencing. I can't tell you how many times I've had patients say, I can't start work until I've spent a couple hours in the bathroom just making sure that everything's taken care of so that I can leave the house without having to worry as much. So they maybe get up extra early. I mean, literally they'll be getting up at 5 or earlier just to say, okay, I know I'm going to have to go through this bathroom routine of multiple, times sitting on the toilet, just trying to make sure everything's taken care of. And then maybe not even eat. Maybe they don't eat breakfast. Maybe they skip, and maybe they have hardly anything for lunch because they're just worried anytime they eat, they might have a problem. So then they eat when they get back home. A lot of incredible things like this that are not uncommon. You think, gosh, how many people are suffering, but they don't talk about it, right? They don't go around talking about it to anybody else. They talk about it to me, of course, but they're not out there just, saying, hey, I got this horrible digestive system and I can't go out. They oftentimes come up with other excuses, right? They just say, well, I don't really feel like going. I'm not going to go out with you guys. I don't want to go to the show or to the restaurant or, to whatever, because I just don't feel like they come up with, you're like, why is this person not interested in doing this? And it might be that literally they just can't, they're just totally uncomfortable being away from their bathroom. Or when they do go out, you'll see these people too. They want to know where every bathroom is, all the time. And they're actually scoping these things out, or they're excusing themselves. Immediately you go out somewhere and then they're excusing themselves to the bathroom when you're thinking, well, and you don't think about it too much. I mean, we all have to go to the bathroom once in a while, but then you start to notice, gee, this person seems to have, just these unpredictable times has to go. If you get to spend enough time with them, or if they're a good friend of yours, and then maybe the more you get to know them, maybe they share a little bit more with you. But unfortunately, this is a huge percentage of the population. The data on these people is that you've got at least 10% of the population and maybe 15% that's suffering from IBS at any one time. So you're talking 30 million people, 45 million people. It's a lot of people. This isn't just a few people. This isn't just, oh yeah, this happens occasionally to somebody. I mean, think about the drugstore. Just that tells you what sells, right? What sells at the drugstore is a whole aisle of things for your digestion. Whether you have constipation, you have loose stools, you have heartburn, you have indigestion, you have whatever. And all these things really are all part of the same big puzzle, even if we don't even call them necessarily IBS. They still are all related digestive issues. There's just a whole aisle, maybe more than one aisle at the drugstore or at the grocery store, just for those kinds of products, which tells you these are big sellers, because they don't stack stuff on the shelves just to sit there and not sell, right? So it's a giant industry and in the drug industry as well, in the prescriptive drug industry, literally just billions of dollars being poured in to these kinds of things, because people aren't actually getting cured, not getting better. They're just treating it symptomatically. And so my personal experience, same kind of thing. When I had it, fortunately I haven't had it for 20 years, but I remember in college, like trying to go for a run, and I loved to be out and running and outdoors and biking and stuff. And I didn't let it stop me, but there were times where just like you're out and I'm like, oh my gosh, I'm on a long run. What am I going to do? Where am I going to go? And next thing I know, I'm trying to find a place to hide. Sometimes there wasn't a place to hide, and you'd be like, oh, I got to go somewhere. And that's pretty embarrassing. I mean, you're thinking, geez, how many times can I get away with this, or can I do this? And that's pretty sad, because it keeps people inside and keeps them from being active. And I mean, I have people all the time say, well, yeah, like can't go on a boat ride. There's no bathroom on the boat or whatever. I can't go out. They're sure as heck not going to be taking the public bus somewhere. Those kinds of things. So these are definitely major life altering issues where you can't socialize like you want to. You can't date. What are you going to do? You're just these kinds of things. And that's pretty sad. There's so many people being impacted by this. And that's one of the things I find so exciting about treating these people and having the IBS treatment center is they get their lives back. And it's really fun as they're out running around doing things, going, oh my gosh, I didn't know I'd ever be able to do this again. And that's just great, for everybody, for them and for me and everybody who works here. It's really fun to see on a regular basis. So we really enjoy that.
That's awesome. Gosh, thanks for going into that detail and sharing those stories. And it brought up a couple things I wanted to talk about. And the drugstore, one day my allergies were driving me crazy, and quercetin wasn't helping. So I just want to get just one Claritin. It was like right when spring was coming here in Seattle, and I went to the drugstore. And like you said, it was all the GI stuff, and then also all the allergy stuff, from steroids to various forms of antihistamines and so forth. It was insane, because I rarely go to a Walgreens or something along those lines. So, which is, we can talk about allergies stem from the gut. So it's all the same problem, just different ways to kind of mask the symptoms. But I have two family members, Dr. Wangen, that have this very same psychological issue related to socializing, and one doesn't travel on airplanes, and if they do, they sit right next to the bathroom due to these issues. And so and like you said, I mean, even though this person is a sibling of mine, we don't talk about these things. I mean, now we're at a level where we can communicate and can offer tips, but it impacts a lot more people than you'd think. And I have another family member who, when they would go drive to work, they knew where every bathroom was on the way to work until we worked on the diet. So Maybe I don't think we got into the functional assessment. I know for people listening, we're going to get into all the tips and tricks and high hit rate foods to avoid and foods to include, but maybe let's talk about functional assessments. Like what sort of lab tests do you run on people when they come in with, these poor quality of life, type complaints and so forth related to GI issues?
Well, like you said, I mean, going back a little bit, like we even have a video on our website of a patient who had that same issue of going on the airplane rides and saying, wow, this is pretty scary. Or just going for driving your car and just like, I hope, I'm going to make it to where I'm going to go. And if you get into too much traffic or something, where are you going to be? And she has a great story, and people could see that actually on our website, ibstreatmentcenter.com. You've got all these different issues. You got, people have bathroom apps even, that now where they can find the nearest bathroom. Not that that's too exciting to go to the McDonald's bathroom or whatever. We've all seen that. That's not always the greatest place. Well, McDonald's usually cleans pretty well, but,
right.
The gas station bathrooms or whatever, not necessarily the funnest places to be. But so starting, the first thing just really was starting with these patients is initially just getting all this history of what have they done and what kinds of doctors have they seen and what have they ruled out, what kinds of tests have they had done, because there's so many different tests that they maybe already have had done or that need to be done. And it's a really broad spectrum. Have they been to the gastroenterologist? Have they ruled out other things? And then as far as the psychological component, they're coming in usually thinking, well, this is probably in my head, or people are telling me it's in my head. Is it stress? Is it that? And we need to assess that. But, most of the time it's not. Most of the time it's the opposite. Most of the time the stress of having IBS is that's what's causing the stress and the anxiety, is that you got IBS, that you got a digestive problem, not the other way around. It's not the anxiety and the stress that's causing the IBS. And so we find that usually it's the reverse of what people think, and that once they feel better, all that goes away. And they actually, some people takes them so long just to they know they feel better, but they're just not quite convinced of it. They're like, wow, I feel better. I don't believe it.
Right.
Is this really I go, don't worry. The longer it sticks with you, the more confidence you'll build up, and the better you'll feel about doing things that you want to do, because sometimes it's just they've been feeling bad for so long. It's hard to believe that they feel good. So, where you start really depends a lot on the patient and on what they've done, because they've done all kinds of different things oftentimes. And there are, like you've probably seen, or the people listening and watching have seen, there are hundreds of different things that are recommended for IBS. And there's, you get out on there and there's all kinds of diets and things like FODMAPs and specific carb diets. And we could go on, and paleo diets, and and there's, everybody's got their latest diet, and there's all kinds of tests and tools. There's things like right now, kind of the latest is that SIBO, that bacterial overgrowth issue, and testing for that. And is that the cause of your IBS? Or is it candida? Or is it, or do you have some parasite that nobody's been able to see? And we could go on. And do you have a gluten intolerance? Do you have this? Do you have that? All of these things actually have a little bit of truth to them. They all have, they're all legitimate to some point. So it's not as if we can write them off and just say, well, this is all completely bogus nonsense. The problem is there are hundreds and hundreds of different things that contribute or can cause IBS, and your symptoms don't really point you in any one direction. You might think they would. You think, because you go to doctors and they're curious about your symptoms, and we need to know about your symptoms too, but they actually don't shed any light on the underlying cause. They don't say, oh, we got to go in this direction or we got to go in that direction. They just say, well, okay, you have symptoms. I just need to know all your symptoms so I can tell how well things are working when we're doing whatever it is we need to sort out. So we are thinking about bacterial overgrowth, and we're thinking about candida, and we're thinking about parasites, and we're thinking about food reactions and intolerances and allergies and sensitivities and lots and lots of different things, but we've got to narrow them down for each patient to figure out what's really, really the problem. So all these things, ironically, most of these things are things that the conventional medical doctors probably don't put any stock in, any one of those, or maybe a little bit. Maybe they say, well, bacterial overgrowth seems to be the latest, greatest thing. Let's look at that. Well, then you've got tests. We've got the bacterial overgrowth breath test, which is a tool, but not the only tool, or not even necessarily the best tool for sorting out bacterial overgrowth. So, but the bottom line is, if that's your doctor's main focus, it always leads to antibiotics. And no matter what, if you've got, and even if, so let's say the test is even negative, then they're either at a complete loss. They're like, well, the test was negative, so we don't know what to do. Or, well, let's try antibiotics anyway, because we don't know what else to do. Yeah. So let's just use them. And they kind of sell you on this concept, well, it's a really unique antibiotic. Well, yeah, it's a really expensive antibiotic, which makes it unique, I guess, to some extent. And it doesn't affect your body in the same way that some antibiotics do. It stays in the digestive tract, whereas most get absorbed. But that doesn't mean it's any different or any better than any other antibiotic. And in fact, a lot of times taking antibiotics is what's led to your problem anyway, or could it be a factor in what's led to your problem? So it's a really oversimplified view, just as one example of a way of addressing IBS. So could it be legit? It could be. You could really have a bacterial overgrowth. But most people actually have a puzzle, and they have more than one factor. And what's happened is these factors have added up over their life. And they've now created a scenario in their gut where it's just not going to heal on its own. It's not going to come back until we sort through the various pieces to this puzzle. And we're looking at a lot of different factors, and we're figuring out, oh, this is relevant in this patient, and this is relevant, and that's relevant. And you've got all these different pieces. And then you're putting together their unique puzzle so that when they do the treatment, as they progress, they keep getting better and better and better, and they keep building on that foundation of the things that you've learned. Because if you don't do that, then you just throw something at them and say, hey, well, why don't you just try this diet? Even if you do get lucky and happen to start to improve, you usually don't even know why, because you're doing too many things. You're cutting out probably way more things than you really need to. And you're wondering, well, do I really have to be strict about avoiding all those things, or can I eat some of them, or how long do I need to do it, and why am I getting better? Are you getting better because you really have to avoid those things forever? Or are you getting better because you're not feeding some bacteria in your gut, or not feeding some yeast in your gut, or some parasite or something that you need to treat? Could you treat those and be fine, and then eat the foods just fine without any problems? So all kinds of different factors play in to getting a patient better. And our goal as IBS specialists is to narrow all that down so we know what the priority is. So, for example, if gluten is a problem, we want to figure out if that's really true. Is gluten really the problem? Or sometimes people already know this. You know what? I just totally can't eat this food, even though my doctors have said it's fine. And I believe you. I believe, because patients often know an awful lot about what's going on with their body. And I'm amazed at how doctors will ignore all that valuable information when your patient comes in and says, oh, I really can't eat this because I know I get sick every time I do. And then they'll run celiac testing. Well, celiac testing is valuable for detecting celiac disease, but celiac disease is just a little tiny fraction of gluten intolerance. It's just one little thing that might happen if you're reacting to gluten. You might be celiac. And so your doctor might test you for celiac and say, well, it was fine, you can eat gluten, but that still might not be true. Or maybe you already don't eat gluten, but your doctor decides to test you for celiac disease. Well, at that point, the test is useless because you already don't eat it. And so all your labs are going to look good anyway for celiac disease. And then the doctor's going to say, well, it's fine. And you're going to say, yeah, but I don't eat celiac. I don't eat gluten. And so sometimes the doctors don't even understand their test well enough to understand when they should run them or when they shouldn't. So as IBS specialists, what we're doing is we're using all these different tools to narrow down, do you have a bacterial overgrowth? Do you have candida? Do you have parasites? And doing tests that usually are way more in-depth and way broader than what most doctors are doing, because they're not really looking at those issues seriously. They're only looking for the big problems. They're looking for E. coli, the bad E. coli. They're looking for salmonella. They're looking for giardia, some really bad, obvious parasite, maybe tapeworm, something that, we rarely see anyway in this country, but still these things exist. They're looking for something that's either their latest, greatest thing or putting you on a FODMAP diet. They're looking for celiac disease, but then they get lost in this world of, well, you could react to any food. You could react to anything. There's no one good food or one bad food out there where I would say, oh yeah, this is what everybody should do or shouldn't do. It really depends on the person. So, almonds could be a problem. Flax could be a problem. Anything that you think is good could be bad. Ginger could be bad for you. And then other things that you hear about are problems. Yeah, they are often problems. Yeah, gluten or dairy or soy or corn or any of those things could be a problem, but they could be fine. And it really is a process. There's not this really nice, cliche answer. Oh, everybody just go do this, and you're going to feel better. But that's why you want to see an IBS specialist, is to try to sort all these things out, because you want somebody who's seen thousands of these cases and knows that they're all different, and that we have to respect that and spend some time with the patient figuring out what this patient in front of me really needs to solve their problem. Otherwise, you just get the one size fits all. Hey, everybody just go do this plan I created, and maybe you'll get better. And if you don't, well, it's not my fault, kind of thing. Because,
right.
It's important to be responsible to your patients, not just to whatever else it is you're responding to.
For sure. Yeah, I love that approach, and that you use your clinical experience to put all these pieces of the puzzle together. And I think for some people that may be frustrated because they want to know that it is SIBO that's causing their IBS or their Crohn's colitis or constipation diarrhea, or it is gluten. So they want to just remove it and then move on to the next step. But I think it's important like you said, your patients often are really in tune with their bodies, and they know what is good or bad for them, but they could still benefit from a clinician like yourself who's seen thousands of patients, that knows how to go down the rabbit hole to figure out exactly what is the root cause. Because although we inherently know what's good or bad, you have some expertise by working with all these people, which I think is really interesting. So maybe since SIBO is really popular, so if we could kind of expand on that a little bit. People often ask about the different breath testing and then treatments, and then should we avoid fermentable carbohydrates, or can we restore our gut to a point where we can have prebiotic fiber again? Maybe can you talk about SIBO a little bit and kind of share your experience with our listeners?
Well, SIBO really is kind of like getting the IBS label. It's really a broad category that's been kind of oversimplified just for convenience sake, to say, well, okay, there's this thing called bacterial overgrowth. Well, what does that really mean? And what are we trying to get at? Well, essentially, what you're seeing is a lot more acknowledgement now and respect of that incredible ecosystem in your gut. So you've got literally not only billions, not only hundreds of billions of organisms in your gut, not even trillions, but 100 trillion or so bacteria in your digestive tract. So you actually already have a lot of bacteria. It's not that you really have an overgrowth of bacteria. You need trillions and trillions of bacteria in your digestive tract to digest properly and to do lots of things properly. Your bacteria help you break down your foods, and they create some vitamins, and they help protect you from other organisms, other bad bacteria and yeasts and things that come down the pipe, because that's where we get exposed actually to most other organisms, is through food. Food's not meant to be sterile. But it's not meant to be super dirty. You just want it. But what happens is we have evolved to have a digestive tract to protect us from all that stuff. And so 80% of our immune system as well is in our digestive tract. That's where it's focused. That's what it wants to do, is protect us from all these other crazy things that we could end up ingesting. Well, over the course of evolution, we've evolved with all these bacteria, and they have evolved inside of us to protect us from all these other things and to do all these other functions, probably most of which we don't even yet understand. But we're just starting to appreciate this microbiome, this world. I like to call it this ecosystem in our digestive tract, because that's really what it is. It's a whole ecosystem in there. And so there's this theory that, well, there's bacteria overgrowth. Well, it's not really an overgrowth per se of bacteria, but it's an imbalance of bacteria, because the bacteria are like anything else. They are a part of a bigger world, like any other ecosystem. It's part of this whole world that's living, thriving in any ecosystem. So if you think of it, for example, an ecosystem, out there, the forest, for example, if you start to put certain chemicals on that, or change the air, and you've got air pollution, or certain other organisms move in and start killing the trees and whatnot, you've changed the ecosystem. You've altered it, and humans, we realize what that means. We know what it's like to interfere into a changed an ecosystem, and we know how difficult it is to bring it back, to make it more normal, to be like we want it to be in its natural state. Well, the same thing is happening in the digestive tract. There's this amazing ecosystem, and we've changed it by eating things that we really didn't evolve eating. So, of course, we eat lots of different things now that we didn't used to eat. That changes the ecosystem because that's a different type of nutrition, different type of nourishment in the digestive tract. We take all kinds of things we never used to take, all kinds of drugs, all kinds of stuff that are changing that ecosystem. For example, every time you take an antibiotic, you're changing that ecosystem. Or any other drug. If you just take, for example, something for heartburn, if you take a proton pump inhibitor, a Prilosec or Prevacid or something like that everybody's heard of, and that's another super big common problem that millions of people suffer from, you're changing the environment because you've changed the pH, the acidity in that ecosystem. So what happens is that things start to get out of balance. You get other organisms growing that wouldn't normally be there, or wouldn't normally be there in the kind of volume that they would be otherwise. So, for example, yeast, candida, that people often hear about online. They hear a lot of anecdotal information about candida, but your doctor, most average doctor is like, what? Nobody's got that problem, or everybody's got it, and it's normal. Everybody's got yeast. Well, yeah, yeast is part of our environment. It's part of our world. It's going to get you're going to get exposure in your digestive tract to a little bit of yeast. But if it's allowed to flourish and to overgrow, it's taking up way too much territory now in your digestive tract. It's over-colonizing. And that's what we're talking about with SIBO as well, with bacterial issues, is that something's over-colonizing potentially. And what is that, and how do you identify that, and how do you treat it? So these breath tests are in trying to assess this and trying to say, well, your bacteria are producing certain gases. And if we make you drink a certain solution and we measure those gases, they'll be out of whack, and that'll tell us that we need to treat your bacterial overgrowth. Well, it sounds kind of plausible. I mean, a lot of things, it's amazing to me how much stuff in medicine sounds plausible that really doesn't make any sense, or the research doesn't support. But this is one of those things where the research doesn't even support the testing. Because if you just take a normal group of people who have no digestive symptoms and you give them a breath test, just as many of them show up positive on the breath test saying, wow, we should treat a problem, when they don't have a problem, or at least they don't feel a problem. And as do when you take a bunch of IBS patients and do the breath testing. So these studies have been really big and really, are really clear, and yet it's still used. A lot of medicine, it's used all the time. And then they say, well, let's use an antibiotic. But I can't tell you how many people I've seen who've been through that kind of testing and who've had that, those kind of specialized antibiotics, and they don't feel any different. They say, well, or maybe it worked temporarily for some reason. And they say, well, I don't know, it seemed to kind of help, but then I got right back where I was, and now it doesn't make any difference. Because things are just a lot more complicated than that. So it doesn't hurt to do that kind of testing, but it's probably not going to solve your problem. So from my perspective, it's definitely on my map. It's on the list of, wow, I need to be thinking about this, but it's not always really easy to assess or to sort out. It's not one of those things that's just going to be crystal clear. Yep, here's the test, here's the answer, here's the treatment. We like that. Doctors like that too. That's part of the problem with IBS medicine, is that the typical doctor doesn't like IBS because it's not easy like that. You don't just go, oh, hey, here's the solution to your problems. And yet studies out there are still all aimed that way. It amazes me how every time I read a study on IBS, they're trying to find that one cure for IBS. I'm like, well, that's never going to happen, because I've seen thousands of IBS patients. There's not going to be one cure, because there are hundreds and hundreds of cures. It's figuring out the right one for the right person and putting those pieces in the puzzle, to sort out what's really going on in this patient, because they're all different.
Gosh, beautifully said right there. That's fantastic. I think our listeners are going to hit the rewind button right there. So let's kind of expand on that a little bit. So what I heard you say is, SIBO is part of the puzzle, but not the major cause of it, or at least other things need to be addressed alongside SIBO. I think a lot of people think, we see this in weight loss diets. For example, Atkins comes out. That's the thing. I'm going to do all protein, high fat, no carbs, and then it switches to paleo, and then it's love FODMAP and simple carbohydrate, and then people kind of bounce around. And I think SIBO is kind of in the limelight right now, and there's all kinds of different causes as to why you were talking about our gut microbiome is imbalanced. And maybe you can talk about some of the high causes, in your opinion, from antibiotics and C-section and breastfeeding. So maybe what are some of the questions that you help put the pieces of the puzzle closer together, in your opinion, when you start to sit down and talk with people about maybe their early life experiences, or you mentioned certain medications like PPIs, maybe we can get into antibiotics that they're exposed to. What are some of those questions that you get into?
Well, those are all relevant. Everything, even like you said, from birth, even is all relevant. How were you born? Was it a C-section or was it a vaginal delivery? Because that impacts the kind of bacteria and the things you're exposed to, right from the get-go. When you first start to develop that ecosystem in your gut, was mom on antibiotics at that time? Because that impacts how your gut ecosystem is developed. Were you sick a lot as a child? Were you on a lot of antibiotics? And, for whatever it was, ear infections, sore throats, you name it, all those things impact that gut environment. I get patients, for example, who were treated for acne with antibiotics for months at a time, maybe years at a time. You can only imagine. That's a huge clue for me. That's a big piece to the puzzle. I'm saying, wow, this is going to be a huge factor that I've got to keep in mind. So definitely we want to know, when we're talking to patients, we want to get the whole picture. I want to know I want to know what happened, what was going on through your life, because that starts to add up, and I'm adding up all those factors. It's not any one thing. It's not any, it's this or that I'm looking for. I'm getting the whole picture. If you've been put on acid blockers, because lots of people have, whatever it is, Nexium, are you buying them off the shelf? How often do you take those kinds of things? Because that changes your gut ecosystem. Almost any drug does, really. Any drug, you name it. Are you on medication for something else, for diabetes or for, you name it. We could just go on and on. Heart medication, cholesterol medications, all these kinds of things. What are they doing to your digestive tract? All these are nice little pieces. So we have to be really methodical and really thorough about exactly how do these things impact your digestive system. So you can imagine why, it's hard for your general practice doctor, your primary care doctor, to do that, because they've got all kinds of other things they're thinking about and other issues. And it's tough enough just for us to start thinking about just digestion. It opens up a whole new world. So we're not even so concerned about diagnosing IBS, because that's just the starting point, right? We're just, okay, here we go. Let's open up this new door into this massive world of where do we need to go now? And then you hear about all kinds of tests out there, but they all have their strengths and weaknesses. So it's not as if there's one test where you say, well, this is the best test to measure that gut ecosystem, or this is the best test to measure your reaction to a food, because different labs have different strengths and different weaknesses. And these are different tools. They're not all equivalent. I can't always compare one to the other. So if you've got lab work, I'll say, yeah, bring it in. I want to see it, because I can learn some things from it potentially, or I can tell you where its weaknesses are and where we need to look elsewhere. So I can say, wow, this test is good with this, but it's not good with this, because I've seen hundreds of them. So, and we will test the labs as well. We'll actually measure their reproducibility and see what they're good at and what they're bad at. And of course, that's a whole subspecialty that most doctors don't have the convenience of, to do. They haven't done that because it's not their area. So it's a wild west, right? It's a whole wild west, even if you're a super gung-ho person about your own health. And a lot of my patients are, they come to me and they say, wow, I'm trying really, really hard to be healthy. I'm trying to eat really healthy. I'm working out all the time if I can. I'm doing all these things that should be working. Why are they not working? Well, because something's wrong. Obviously, you're missing some big piece of the puzzle. And that's what I want to help you find. It's just that what we've all been told is healthy isn't necessarily always true. Or there's been so much damage previous to all this, so many issues that have, like, for example, changed that gut ecosystem, or some other factors that have been going along all these years, that now we're going to have to gradually work through those. It's not like it's an overnight cure necessarily, even though you're trying to do all the right things. I mean, I'll get patients all the time who say, I can't eat salad. I just can't eat salad because I can't digest it. That's classic in IBS patients. Or I can't eat an apple or whatnot. And a lot of times it's not the food that's the problem. They're maybe eating really good stuff that you should normally be able to digest, but you can't because there's already so much irritation in your gut, so much inflammation, so many things that are off, that now you can't break down things that you should be able to break down. And so then it's really confusing to people who are, really paying attention and trying. They're saying, yeah, but why do I react to this? There must be a problem. And now they're not even sure. Is it the food? What is it? Why can't I eat this? And it's not consistent. It'll change from day to day. And because maybe it's not really the food that's the problem, or the other factors that they're not aware of yet, the problem. So that's always the goal, is to sort those things out and then get those foods back. Usually, like a lot of times the vegetables come back, the apples come back, a lot of things, once your digestion can handle it, can break that stuff down. But raw food, for example, hard to digest. So you may think, wow, raw food is really good for me. It's got lots of nutrients. Well, maybe not. If your digestive tract's not up to speed to handle that, then maybe that's the wrong thing right now. We're going to have to work back to it gradually. So these are the kinds of issues, we're dealing with. Even patients. I mean, I just got an email from a potential patient this week who said, I can't even drink a glass of water. Like, yeah, I can't even count all the times I've heard that. I've heard that many, many times. And it's not that water is the problem, right? I mean, the water's not what's causing your digestive problem, but I believe that it feels like you can't drink water now because that is what it's come to at this point. Things are so bad that anything you put in your digestive tract, now it's not feeling good, even water. So our goal is to sort all that out so you can start to get those things back in and feel good and add more and more, but figure out if there really are things that you won't be able to add. I mean, there might be something that you just won't be able to add, because if you do, it's the one thing or the two or three things that are going to set you off or make you regress gradually, which is another tricky one, because a lot of people think, well, if I eat something, I just get a reaction right away. Well, unfortunately, it doesn't always work that way. In fact, a lot of times it takes days or weeks or even months before you start to feel symptoms, which is what may have happened initially. It may have taken years for that problem to build up to a point where you noticed it. And now you're like, yeah, but I always ate that food. How come I can't eat it now? Well, maybe that was the wrong food for a long time, but it was so subtle. It took a while, it took years even before it wore you down. Now you're like, you can't eat it. And you think, well, if I just go off of it for a while, can I get it back? Well, some foods you can, some foods you can't. And that's what we do, is help people sort through those priorities so that they can figure out which foods they are going to get back and which foods they maybe won't get back.
Yeah. Great information there. So for people that resonate with that, like they can't drink a glass of water, or, an apple bothers them, or like you said, salad. I hear that a lot over the internet. I'll make a beautiful salad. I'm like, put it on Instagram to like kind of share the recipe. And a lot of people come in like, I could never eat that. That's too hard on my gut. And I'm thinking like, gosh, that would be really tough how do you get all your nutrients? So the question that I had for you there is, do you follow like a 4R program, remove, repair, reinoculate, and restore, and so forth? Or do you have your own program? I know everyone's different, but if we could kind of maybe end with some tips for people, they work with a practitioner, maybe high hit rate therapies to calm down that inflammation so that people can kind of start to eat more healthy foods that maybe have bothered them in the past. Any high hit rate things you could offer?
Well, there isn't any kind of one like nice catch, phrase. I like that though, the 4 R's. but yeah, the goal is first off to get people feeling better, obviously, because if they're not feeling better, then what's the point? If you're doing things and you're not feeling better, then why bother doing them? So of course you got to get feeling better. I mean, it's all about how the patient is. Are they feeling better or not? So I know they're repairing if they're feeling better, and that's of course number one key. So as their health is improving, I know we're on the right track. If they're not improving, then I know we need to find some other pieces. So that's the first thing. Then what you're doing is as they're feeling better, they're developing their confidence in the whole plan, and they're developing, they're getting more hope now for what is the potential out there? What can they do, and how good can they feel? Because a lot of people they don't remember what it was like to feel good. They don't even know what normal is. They don't know what normal bowel movements are. They don't know what the hell that is. So we're getting them along that track so they can get to a point and they can say, yeah, now you are at a point. This is what a normal person feels like. Normal, healthy person feels good here. And there aren't any, ironically, I don't use a ton of supplements. So I don't say, oh yeah, I'm going to use probiotics in this person and always use this herb or always use that, because honestly, everybody is really, truly different. So there isn't something where I'm going to say, yeah, I'm going to do this or do that to help heal the gut, because helping to heal the gut is so individualized that whatever their plan is, that's what's healing their gut. And we can tell it's healing by how they feel. And then as they're healing and they're getting better, it's a matter of figuring out, when have we accomplished that? So as they go along and they've healed and feeling better and better, we can tell that, oh yeah, we've gotten whatever it is treated that we were trying to treat. If we were trying to treat a bacteria or candida or just calm inflammation or whatever, because all these things trigger inflammation. All these organisms do, all these, if you have a specific food reaction, that's trigger inflammation. So all these things are triggered inflammation, and the key to dropping that inflammation is targeting whatever those individual items are that we need to target in that person, not just giving them an anti-inflammatory. Now, some of those things are supportive and useful, but what I find is that people often come in with a big bag of supplements that all are actually really cool, nice supplements, but they're not working very well because they haven't gotten to the underlying cause of the problem. So I'm usually saying, well, these are nice things, you could take them, but you might want to just table these for a while. Let's work on getting to really the fundamental issue. And then you can maybe implement some of these supplements later, that might be helpful. But, all these things that people have heard of, yeah, they have value, but are they what you really need? You might not even need probiotics. You might not even need whatever glutamine or, or quercetin or any kind of thing like that. You might need something completely different. So is it even worth spending your money on that stuff right now? So we're trying to really prioritize that too, as what should you be, spending time and money on and effort doing to help you get better. And then as you're getting better, if you're getting stuck, maybe sometimes we add some things in to help push that process along. But we'll have people work with our nutritionist, for example, who's great with all those issues as well, getting that full, well-rounded nutritional assessment, not just avoid this, avoid that, but hey, let's make sure you're eating healthy stuff. I mean, how many people have I seen who are gluten-free, but all they eat is gluten-free junk food, right?
Yeah.
That doesn't mean they're healthy. It just means they're gluten-free. Or we could say the same thing about vegetarians or any diet philosophy, right? I mean, what are you eating is just as important, if not more important, than what you're avoiding. So I'm all about trying to really fundamentally change their lifestyle so that they're healthy long-term, like, from here on out, and they just keep feeling better and better and better. And maybe using some herbs or some supplements. But usually those are super targeted, where I'll see a patient, I'll say, wow, holy cow, we've got to use bingo this. But I always even hesitate to share that, because it's not going to work for most of the people who are watching it. It literally isn't. It's just not. I mean, we have supplements that we make for ourselves that we have, that have our brand on it and everything. Yeah, I love them, but I don't like to push them because they're probably not what most people out there need, unless we figure out, oh yeah, you're the person that needs this one thing. You need it. People are welcome to take them, but that's not really the cure. The cure is finding out what their individual picture looks like. So what I really want people to come away with is don't give up. No matter how many people you've seen, or even lots of alternative doctors and stuff, don't give up, because there's somebody out there who's really a specialist in your area who really can help you. And it's just one of these things where it's easy to feel like, man, I've done everything. I've read everything. I've done it all. And boy, I haven't even done everything. I haven't read everything. And I'm spending all my time just focusing on this one issue. So it's just a complex issue that everybody's learning more and more about as we go. There's a lot more data coming out every day about this amazing world in our digestive tract. And we're just at the IBS Treatment Center trying to take that to a whole nother level than has been done before, because it is a really complex area. And there are so many valuable things that we need to learn and sort out in this area. And so that's what I would say, is that just don't give up. Just keep working on it, because if there's a problem, there's got to be a cause. Mm-hmm. And it's got to be something that if you find the right person, it's just like anything else. You got to find the person who can solve that problem, whether it's your car or whatever it is. There's an issue. It's don't just give up and say, well, okay, I just have this syndrome and it's just genetic. I mean, you wouldn't do that with your car, right? You would say, well, my car doesn't work and it's really sad. The mechanic said it's just bad car syndrome and my car doesn't run. Yeah, that stuff frustrates me. And it's sad because I see so many people who really do. They say, I've basically given up. I don't even think, you guys can help me diabetes treatment center. I say, well, let's just start from the beginning and start over here and see what we can do.
Yeah.
So, yeah, it's exciting. It's fun. And we love working with those kind of patients because there's always so much more that can be done.
That's fantastic. Yeah, your approach is really the epitome of functional medicine. There is no protocol. You're treating each person as an individual and really getting to the root cause of that. So I like that approach. And so we just have a couple of final questions here, and we want to get to know you a little bit better and want to know what's your favorite herb, nutrient, or botanical. So if you were to go on vacation on a mountain bike trip, for example, or go away for 4th of July, what's in your supplement bag or your food bag? What are you taking?
Geez, I don't take a whole lot. Honestly, there isn't like any one magical thing. Like, let's say though, if you, it depends on kind of your issue. So if you're the kind of person who has like tends to have a lot of yeast, a candida kind of problem, and you need a particular, thing that maybe you eat a little too many sugars, it starts to get out of control. And you feel like, man, I got to have something to put that in check. You might take something, but what we find, I know that is the answer always gets frustrating, but is that everybody's yeast, for example, is different. So you hear that, oh, garlic's great, or caprylic acid or whatnot is great. But I can tell you, having seen lots and lots, like hundreds of sensitivity panels, every yeast is different. Sometimes garlic works, sometimes it doesn't. Sometimes caprylic acid works, sometimes it doesn't. Sometimes, whatever it is, oregano works, sometimes it doesn't. And people have heard about lots of different things, ways to treat these things. Well, that's another part of this complicated, challenging picture, is that your yeast might not be reactive to that at all. And it's not just because it's natural. I mean, it might be resistant to the prescriptive things and more sensitive to the natural things, or vice versa, or resistant in both areas. I mean, it literally is different. So like what I would take will be completely different than what the next person will take. And that's one of the things that we have to work with on patients to make the treatment successful, because they'll often say, yeah, but I treated with this and this and this, and it didn't solve my problem. I say, okay, but that doesn't guarantee that that's still not the problem. Even though you're trying to treat yeast, for example, and it's not working, it still could be yeast. Because yeast have resistance just like bacteria do. So you hear about, wow, bacteria can be resistant to this antibiotic or that antibiotic or whatnot. Same kind of problem. A good probiotic, you kind of can't go wrong, but do you even need it? Is it going to help? I mean, you probably already know. I don't necessarily travel with them. I just try to eat well when I travel. So what I do is I just take stuff with me. I'll take snacks with me. I know I can eat well and aren't going to cause problems. Or if I'm traveling, flying somewhere, I go to the grocery store first. And I make sure I've got some food with me that I know is going to be good food, because otherwise you get tempted to eat something you shouldn't, and then that's where you get in trouble, right? And then you go, whoops, I shouldn't have eaten this thing, and yikes, because you get hungry. So, you do that, and then you have your little apps, like there's apps for finding different, there's like the gluten-free restaurant app, find me gluten-free, and you go, oh, okay, I can find gluten-free here, or whatever it is you need. But we try to help people with those kinds of tools. Once we know what they need, what their problem is, we'll identify specifically what tools are going to help them.
Awesome. I didn't know about that app. I'll put that in the show notes at highintensityhealth.com/drwagner. So great tips there. And last question, if you were to bump shoulders with Barack Obama or a future president, maybe in the elevator perhaps, and you turn to them and were to give them just a little health or lifestyle tip, maybe they could implement policy around, or something that you would want them to share with Americans, what health tip would you offer them in 30 seconds?
Well, I probably plug the IBS treatment center, because what I would what I would say is that for sufferers of digestive problems who want to get their life back, the IBS treatment center is the only treatment center dedicated solely to diagnosing and treating IBS. And we've successfully treated thousands of IBS patients, literally from around the world. We get patients from all over. And unlike other clinics, we're highly specialized in treating IBS, and that's what I would say as a plug. And it's all about being really highly focused, because you could be. I don't do other kinds of medicine. We just do digestive medicine, just like that. We don't do any kinds of other natural medicine, because they're specialists in other areas, and people who do other things. So that's exactly what I would say, is I would get into that.
Fantastic. That's great. So maybe along those lines, in closing, we'll talk about your website and where people can learn more about you and your work.
Yeah, our website is ibstreatmentcenter.com. And there's tons of information on there about what we do and how we do things. My blog, Facebook, Twitter. We have all the social media. If people want to follow us, that'd be wonderful. But ibstreatmentcenter.com is kind of like a book. It's got loads of information if people want it. So and it's free, of course. So yeah, check out the website.
Fantastic. Thank you so much for coming on the show.
Well, thank you, Mike, for having me on. I really appreciate it.